seen a lot of people in time past, they come down and they say that, oh, we are having issues with conception. But do you know that before you can even tag yourself as infertile, it has to be after 1 year of constant, penetrative, sexual, regular intercourse. And for the woman, you have to be aged less than 35 years. If the woman is greater than 35 years and then they are having regular, constant, penetrative sexual intercourse and they are not able to conceive in the first 6 months of life, this is why when we tag them as infertile. But for other women who are less than 35, it has to be after 1 year. And I know that a lot of people would be like, wow, so it means that it's not immediately someone gets married that they start, the percentage increases with the time they've spent together. And according to the research, it was being stated that in most couples, 80% of couples, they are able to achieve conception in like their 9th month of regular, constant sexual activity. So this is just to allay your fears if you're newlywed and you're already worried that, oh, maybe I'm already experiencing infertility. Now in this, I'll be talking to you about what are some of those things that could really predispose one to infertility, some of the habits that we might not know but that needs to be known in order to increase your chances of conception, and some of the popular misconceptions about infertility. So as I've made mention of from the definition, if your marriage is not up to 1 year and or if your partner and you are not having regular intercourse, and regular intercourse 3 times in a week, 3 times days, and it's 3 times in a week, that is when you can even say that your sexual intercourse is regular. And another thing I noticed about most women is that they are not aware of what we call their ovulation period. And this is very, very important in ensuring that you're doing the things the right way. So your chances generally increases when you are meeting your husband during your ovulation period. What this means is that this is when your egg is ready to meet the sperm of your husband, and then fertilization will occur, which results into pregnancy. Well, for different women, they have different days of the month, which happens to be their ovulation days. But one of the things that you have to know as women is that, one, you have to know what is your cycle length. Now, when I talk about cycle length, I mean that if you have your period today, for example, the period of time between the days you are having it till the next month, when you calculate it, is what you have as your cycle length. A normal cycle length is between 21 days to 32 days. However, be sure of which days are your own. You have to have monitored it for a period of 2, 3, 4 months, and then you have an accurate day. And sometimes you might wonder that, oh, why is it that it doesn't come the same day every month? It doesn't have to come the same day every month as far as it is within the range of your cycle length. So what I do personally is that I have a place that I document my cycle length, right? So in a period of 1 year, say for example, I have 27 days coming like 5 times, and then the rest of the days are coming maybe 2 or 3 times. The one that takes the dominant one is the 27 days. So that automatically is my cycle length, and that is how I work with it. So this is a very practical way for you to be able to track. Is this, you divide it by 2. So you divide 27 by 2, which is 13.5, right there about. So 4 days before that actual day of your ovulation and 4 days after is tagged your unsafe period. Some school of thought will say it's 2 days before and 2 days after, plus the day that you are actually supposed to have it. But those period is tagged your unsafe period. So ensure that you and your partner, you meet constantly around this time to increase your chance. Now, some of the myths that it's usually being said, especially in this part of the world, Africa and Nigeria, is that infertility is a woman issue. I want to debunk that. It is being shown, by the research, that most of the cases of infertility, 30% could be caused by both the male and the female factor. So it means that it could either be an issue from the male, that is the husband, or the female, or even both of them having issues. So this doesn't necessarily mean that infertility can only be caused by the female gender or by the male gender. And another thing is that I noticed that when I go to the ONG clinic, I noticed that it is only women that present. Why is that? Because there is this mentality that, it is the woman that must have an issue. And most times when you do your investigation, you might realize that the man in question has some issues, maybe with the sperm count or even the quality of the sperm. And of course, this could affect the chances of conception in both ways. Another thing that is very popular in terms of the myths is that probably if the woman is older, some people even tag age 30 as, once the person is like 30 years, the person will not be able to conceive. Well, as I said earlier on, as far as the woman is not up to 35 years of age, the chances is still normal, like in every other person. Okay, all you have to do is just to ensure that you meet your husband during the period of your ovulation. And most of the time, 50% of this infertility issue is being solved if these parties can actually maintain this ovulation period. However, there are still some medical conditions that could hinder a woman from getting pregnant. Sometimes we have conditions like fibroid, polycystic ovarian syndrome, maybe a damaged fallopian tube or uterus, or chronic pelvic inflammatory disease, or as I said in the male factor, probably a structural issue with the male genitalis, or even an issue with the sperm count or sperm quality. So these are some of the common things that could cause issues with advancing age. So yes, with advancing age greater than 35, the chances reduces. Another thing is lifestyle, the kind of unhealthy lifestyle, obesity, alcohol consumption, smoking, illicit drug use, or having multiple sexual partners that could predispose into sexually transmitted infections, chronic injury, even a family history of infertility. These are some of the factors that could predispose the woman. Hormonal imbalance, very, very important. These are some of the factors that could predispose the woman into infertility. Some of the male factors, undescended testes for the male, having history of varicosis, moms during childhood, wearing tight unders, or not having adequate exercise, eating habit, bad eating habits, smoking. If you are over a year in marriage and you are experiencing infertility, and you know that your sexual intercourse is consistent, it is regular, and still your marriage is over a year and you're yet to, and you've been maintaining this ovulation period, you know your cycle length, you and your husband ovulation period, and still there is nothing to show for it, this is the time for you to now come to your health providers so that will be able to carry out adequate investigations and be able to know exactly what is wrong. Now, having found different things that can be wrong either with the male or the female, different method of conceptions can be offered, which is going to lead me to my next video. So if you enjoy this video and you want me to do the other video, which is on in vitro fertilization, then drop your comments down below. See you in my next. Thanks so much for watching.